Quick CPR demonstration. Step 1. Check for consciousness. Then proceed to Step 2. Open the airway. If the victim is already out of this world, then begin the rescue breathing. Give 2 full breaths, then check for circulation. And finally, the last step, begin chest compression. Continue the process until help arrives.
Dealing with electric shock. How to handle emergencies involving electric shock. There are steps in handling emergencies involving electric shock. A. Don't waste time to switch off or remove plugs. Immediately switch off the master fuse to turn off all the power. These are things you can do to help without injuring yourself. B. Stand on a thick pile of newspapers or rubber mat if the ground is wet. Wetness makes you a conductor of electricity regardless of what you are standing on. C. Try to push the injured off the live wire by using a wooden broom, mop, or pole. Your hands must be dry. Next, treating for electrical shock before help arrives. A. Because shock is more of a risk with electricity than other types of burn, check the injured person's ABC and take the appropriate measures. If the person is not breathing, immediately begin mouth-to-mouth resuscitation. B. Apply small amount of antibacterial or burn ointment on the burn skin. C. Keep the injured person on his or her back with his or her feet and legs elevated. D. If the injured person is unconscious, gently turn him or her to the side, supporting the head with a pillow. This will aid breathing and keep shock damage from increasing. E. Gently cover the injured person with a blanket.
Bumps and bruises are the most common type of injury, and in most cases, they're the ones that needs least amount of first aid. Shocks coming from common households and outlets. So bumps and bruises are damages that occur in the soft tissue under the skin. So there is no need to call medical assistance if the person suffer cuts, scrapes, bumps, or bruises if 1. The injury is small or less than 1 inch round. Another is that there is no bleeding or just slight bleeding. Another also is that if the person does not feel numbness or tingling. And lastly, if the person does not suffer any paralysis. First aid for cuts and scrapes. So what are the things to do with this? So first, if the injured area has a skin scrape, wash it with mild soap and lukewarm water. Second, apply antibacterial cream or spray to prevent infection. And third, cover the wound with sterile gauze pad or tape or even a simple band-aid. So another is that the steps in treating bruises. So what are the steps or the best thing to do with this? First, immediately apply an ice pack on the bruise to reduce swelling. Second, if possible, elevate the affected area or the bruised area so that it is higher than the heart to prevent blood pooling in the affected area. And lastly, the third one, seek a medical help or assistance if there is any swelling around the bruise. This can be a signal danger to the nerves, muscles, or the bones.
Animal bites and scratches that break the skin can sometimes cause infection. Some bites need stitches, while the others can heal their own. Rarely, Bites from wild animals can lead to rabies, a life-threatening infection. Bats, raccoons, skunks, and foxes can cause most rabies cases. What to do? First, wash the bite area with soap and water. If the bite is bleeding, put pressure on it using sterile gauze or a clean cloth. Second, if the bleeding has stopped, put antibiotic ointment on the area. Third, cover the area with a bandage or a sterilized gauze. Lastly, if your child has pain, give ibuprofen.
How to handle a fainted person? Let us first define what is fainting. Fainting occurs when your brain temporarily doesn't receive enough blood supply, causing you to lose your consciousness. Fainting is not usually serious, however, sometimes it can indicate a serious medical issue. So if you feel faint, lie down or sit down. To reduce the chance of fainting again, do not get up too quickly. Next is place your head between your knees if you sit down. Now, if someone else faints, position the person on his or her back. If there are no injuries and the person is breathing, raise the person's legs above heart level for about 12 inches or 30 centimeters if possible. Loosen belts, collars, or other constrictive clothing. To reduce the chance of fainting again, don't get the person up too quickly. If the person doesn't regain consciousness within 1 minute, call 911 or your local emergency number. Now, check for breathing. If the person isn't breathing, begin CPR or call 911 or your local emergency number. Continue CPR until help arrives or the person begins to breathe.